How do I interpret cognitive test results for dementia? When you hear about cognitive test results, it can seem confusing at first. These tests are tools that help healthcare professionals get a snapshot of how well your brain is functioning. They look at different mental skills like memory, attention, language, reasoning, and problem solving. But it's important to remember that these scores are just part of the bigger picture. They help guide doctors to decide if further tests are needed, but they do not give a final diagnosis on their own. Most common tests include the Mini Mental State Examination, the Montreal Cognitive Assessment, and the Mini-Cog. These tests give a score that falls into categories like normal or below normal. A normal score usually means your cognitive abilities are within the expected range for your age and education. However, it doesn't always mean there are no issues. Sometimes early signs of dementia can be subtle and not show up clearly on these tests. That's why a healthcare provider considers other factors too. If your score is below what's expected, it suggests there might be some cognitive difficulties. This doesn't mean you definitely have dementia, but it does mean you should have more detailed testing and a thorough medical checkup. These additional assessments can include neuropsychological testing, blood tests, and brain scans. They help identify if there is a treatable cause like vitamin deficiencies, thyroid problems, or medication effects. It's also very important to consider your background. Factors like education, language, and cultural differences can influence test results. Someone with less formal education might score lower even if their brain function is normal. That's why healthcare professionals interpret results in the context of your overall health and life situation. Talking to someone who knows you well, like a family member or close friend, is also key. They can describe changes in your daily life and mental abilities over time. Dementia usually causes noticeable declines in daily activities, unlike normal aging, which might involve minor forgetfulness. The pattern of deficits across different cognitive areas matters a lot. Dementia often affects multiple skills at once, such as memory, language, and reasoning, and leads to difficulties in everyday tasks. When test results show problems in these areas along with reports of functional decline, it supports the possibility of dementia. Remember, no single test can confirm dementia or tell you what type it is. Results should always be considered alongside your medical history, physical exam, and possibly brain imaging. This comprehensive approach helps rule out other causes of cognitive problems, like infections or medication side effects. If you or a loved one have had cognitive testing, keep in mind that a low score indicates some level of difficulty but doesn't provide all the answers. Your healthcare provider will discuss what the results mean and may recommend more tests or specialist referrals. Early diagnosis can be very helpful for managing symptoms and planning care. In summary, interpreting cognitive test results involves looking at the scores in context. It's about understanding that these tests are screening tools, not definitive diagnoses. They are one piece of the puzzle that, combined with medical history, daily functioning, and further testing, helps healthcare professionals understand your brain health. Always consult with a healthcare provider for personalized advice and guidance tailored to your specific situation.